Hello, my name is Navida Dolopo. I'm a licensed acupuncturist, and the name of my practice is Elements in Harmony, Acupuncture, and Chinese Herbs. You can find me at elementsinharmony.net. I've been in practice for 21 years. I started practice in 1999, and this is my 86th video, and I'm very excited to present this case to you. Even though she's only had 14 treatments, we have had tremendous results. I do Balance Method Acupuncture. I've been a Dr. Tan's Gold Level Certified Balance Method Acupuncturist since 2012. I started practice in 1999. I started studying with my master, the late Grand Master, Dr. Richard Tefu Tan, on March 6, 2006. And since his passing in 2015, I've really kept my loyalty to his top student, Dr. Eileen Han, and as of this year, I've been put on the faculty, and it's quite an honor with Dr. Eileen Han as the teacher of the main presenter for the business acumen for successful acupuncturists. So it's been quite a journey in my acupuncture profession and my acupuncture career. And this particular case means so much to me because I've presented 85 other videos and only one other case was on an autoimmune issue. This one is specifically on lupus, and I'm just going to go tell you the case study. I'll make it short and sweet just so you can get the gist of everything. The results are amazing. So basically the markers of her improvements, the ANA titer, I believe that's how you pronounce it, that presents in preclinical autoimmune disease. It should be 140. It was a 320, and then it became a 180. I need to get it to a 140. So those are great results. And her rheumatologist was floored. And I'm not a lupus specialist. I'm just reading according to the report provided to me. But this is what the patient was explaining to me. She's 40 years old, by the way. Also, her DNA antibody shows that it was before her 11 treatments when she took the test. It was a 13. It became an 8 after 11 treatments, and it should be a 4. So that right there, I think, is what caused the rheumatologist to be astonished and really excited for the patient that she can potentially be lupus free. She took her off all lupus medication and told the patient on Monday, she saw the rheumatologist earlier this week. Today is Saturday. And the rheumatologist told my patient, whatever you're doing with the acupuncture, keep doing it. I don't have this patient on any herbs. I'm only doing Balance Method Acupuncture. And again, there were 2 particular markers that she was looking at. Before it was 320, now it's 180, and I have to get it at 140 for it to be negative. And before it was an 13 for the DNA antibody. Now it is an 8. It needs to be a 4. The doctor took her off lupus medication. That is amazing. She's back to work. The issues of the lupus, the symptoms that she was suffering from were inability to sleep, very fatigued, not wanting to do anything. She had to put herself on disability, on medical disability, because she was just not able to function, not able to work, not able to focus, very low energy, not happy, severe depression. And of course, if you're not feeling good, you're not going to want to do anything. So now, after, let me see, she's had 14 treatments, but after 11th treatment, she took that test. And it was around that time she had already been working. And she has been doing extremely well at work. She's not taking on anyone's stress. The stress from the office, she's not taking it in, which is a big deal because before she would just, let people's stress affect her, which was really impacting her health negatively. So let me just tell you the dates that she received treatments. February 15 and 28. Not very aggressive there. Then March 2, 4, 8, 11, 14, 19, 26. A little more aggressive. and then April 3 and 9. After April 9 is when she had her 11th treatment and she took the test again. And then April 19, 26, and the 3rd of May. So she had 2 in February. And then in March, that's when she was more aggressive. She had 1, 2, 3, 4, 5, 6, 7 in March. And so she was about averaging almost 2 a week. And so she was able to, I really feel that that was, I tell people, if you want to be aggressive, come back within 1 to 4 days. And she really wanted to be aggressive because, you know, it does suck to be on the workers, you know, on disability. My patients that are on disability, they're not super happy. They want to contribute to society. They want to work. They want to be out of the house. It's not like they're on vacation. They really don't feel well. And so for this patient, I remember after her 13th treatment, I treated her, what time did I treat her? I treated her 5:50 p.m. And I asked her, what are you going to go do now? She must have gotten out of here around 7 o'clock. And she goes, I'm going to go shopping now. That might not be a big deal to people like you and me who have tons of energy, but to someone who's 40 years old and who has been suffering from an autoimmune issue, that's a big deal to be able to do things like go around the mall. I'm down the street from Irvine Spectrum, or go to Target and, you know, shop around for an hour. Just to walk around is a big deal. To go to Costco and spend like 30 minutes to an hour, that's a big deal to many people. So don't underestimate the power of what having more energy does. When a person can sleep better, when a person can get back to work, when a person feels like going out of the house, that means their dopamine's up, they feel like doing something, they don't feel depressed. She does not look depressed anymore, she doesn't act depressed anymore, she's super happy, she's telling everyone at work, you got to do acupuncture. I mean, because she just feels amazing. On top of that, she has not been complaining about any pain. She used to talk about nausea, hot flashes, horrible fatigue, nightmares, headaches, pain in her elbow and her wrist and her forearm, pain in her lower back. I mean, she's just not dealing with any of that. And so, you know, she's not cured yet, but the rheumatologist seems to be very hopeful with the acupuncture. The patient seems very, very hopeful that this can potentially cure her. And I'm very, you know, I'm on that boat with them. I mean, the numbers don't lie. The subjective results, you know, having more energy, being able to sleep, being able to go back to work, wanting to go shopping, wanting to have a life again, wanting to hang out with her friends. And she volunteers in the weekend at the shelter with cats. I mean, that's a big, big deal. To stay home from depression and sadness and pain and, you know, just not feeling in her best form, that can't be something that a person wants to live with. When a person takes off work, usually that's because they want to go on vacation, not because they want to go on disability. So I'm very proud of this particular case because she's super young. She's 40 years old. I'm seeing the natural, we'll call her H. I'm seeing the natural age, when she's like, I can't believe how good I feel. I can't believe how well I sleep. I can't believe how good my body feels. That's natural. Having tons of pain and depression and not wanting to move and not wanting to go out with your friends, and she's a single woman, she's gorgeous. I mean, that's not something that, you know, a person really wants to live with. So if you know of anyone who's really suffering from lupus or any other autoimmune issue, please feel free to have them contact me, elementsinharmony.net. You can just go on my website and book your appointment there, or you can call me on my landline at 949-305-1703, or you can text me. I get back to text much faster. I've got 3 kids, as you can see from the picture above. My cell phone is 619-341-4341, and I look forward to hearing from you. So again, if you know of anyone who's severely suffering from any type of autoimmune issue, especially with lupus, please feel free to let them know that I can help. Take care, and if you don't live in Orange County and you need a balanced method acupuncturist anywhere around the world, just text me or you know, email me at anna@moveyourchi.com or call me, and I can find someone for you anywhere around the world. So hopefully, and if they're not a balanced method acupuncturist, that's totally fine. Just someone that you can totally commit to, at least for 10 to 20 visits, to see at least 30 to 80% improvement. I would say in this case, to go from 320 to 180, you know, we're at least 40% improved. We're at least in the numbers, at least 40% improved. And her emotions, at least 80 to 90% improved. So whoever you can develop a great rapport with and be able to be consistent at least 2 more times a week for at least those first 2 to 6 weeks, you'd be surprised what can potentially happen with your health so that you can have your life again. All right, have a great day. Thank you for watching this video.